Good afternoon. My name's Christina Graham, and I'm a registered dietitian and a certified diabetes care and education specialist here at Titus Regional Medical Center. Welcome today to our Adult Diabetes Support Group meeting for February 2022. Today we'll be exploring diabetes and its connections to our heart health. So I just want to share some statistics about heart health today. Heart disease is the leading cause of death in men and women in the United States. The most common types of heart disease are listed here. They're coronary artery disease and vascular disease, arrhythmias, and structural heart disease and heart failure. Sadly, people with diabetes are 2 times more likely to have a heart attack or a stroke than people without diabetes. So I just want to define a little bit about these conditions, these 4 types of heart disease. In coronary artery and vascular disease, the arteries in your heart become narrowed or blocked by the accumulations of cholesterol in the areas that supply the heart with blood. This is the most common type of heart disease, and it causes most heart attacks and chest pain. Arrhythmias or heart rhythm disorders can cause the heart to beat too slowly, too quickly, or in a disorganized fashion. Structural heart disease is caused by abnormalities in the heart structure like the valves, walls, muscles, or blood vessels. And heart failure develops after the heart has become damaged or weakened. This damage may be caused by a past heart attack or high blood pressure. There is no cure for this condition, but lifestyle changes and medications can lead one to be active and extend their life. So heart disease often does hide amongst a group of symptoms. People will often have 3 or more of these symptoms, and if they have at least 3, it's considered metabolic syndrome. The conditions leading to metabolic syndrome are hypertension, which is a blood pressure really over 120 over 80 is normal, but if it's greater than 130 over 85, there's definitely concern. Abnormal cholesterol, especially a low good or HDL cholesterol, when that HDL is less than 40 milligrams per deciliter. High triglyceride levels, that's 150 milligrams or more. A waistline greater than 35 inches in women and 40 inches for men. And high blood sugar, a fasting glucose greater than 100 milligrams per deciliter. So when somebody has 3 or more of these conditions, like I said, they're considered to have metabolic syndrome, and that can lead to heart disease. Heart disease is sort of like the picture you see on this slide of an iceberg. As the Titanic sailed along, only the tips of the iceberg appeared above the water. The captain did not see all of the points of ice underneath. With diabetes, risk factors of heart disease peak out at different times. For some people, high blood pressure is the first sign of danger. However, for others, high cholesterol suggests an underlying problem. So like the captain of a ship scanning the water, it is extremely important for people with diabetes to routinely monitor for these hidden risk factors of heart disease with their healthcare provider. So in this diagram, you can see a little bit about how diabetes does affect our blood cholesterol. Another name for our blood sugar is blood glucose. And our body uses this blood glucose for energy, and insulin is what carries the glucose into the muscles where it becomes used as fuel. People with diabetes do not have enough insulin to move that blood glucose from their bloodstream into their muscle cells, or the body's resisting the insulin, and in either case, the blood sugar builds up in the blood rather than getting to the part of the body that needs it for fuel. Because muscles always need energy, your liver combines fat, called triglycerides, with cholesterol to use as an alternate energy source when your blood sugar is high. So when blood glucose is high or blood sugar is high, your triglycerides and your cholesterol levels also can tend to be high. And this can lead to atherosclerosis or fatty deposits on the insides of your blood vessels. So, the American Heart Association and the American Association of Diabetes Care and Education Specialists recognize these targets of care that can greatly reduce your risk for heart disease. The first is related to your blood glucose. And you can see here for people with diabetes, it's recommended that their fasting blood glucose be between 80 and 130. So if you haven't eaten for 8 hours and you test your blood sugar and have known diabetes, your blood sugar ideally at the time of fast, at the end of the fast, should be between 80 and 130 milligrams per deciliter. And if you happen to test 2 hours after eating a meal, your blood glucose should be less than 180 at that time. Home blood glucose testing is very important as it tells the person with diabetes how their day-to-day blood glucose levels are doing. This can also help the person with diabetes identify patterns of highs or elevations that they might not even know if they weren't testing. I often say to my clients, we can't feel blood sugar very well. So if you're not testing, you really don't know how you're doing. There is a test that your care provider will likely do every 3 to 6 months. It's called the A1C. And this A1C essentially gives us what your average sugar has been for the last 2 to 3 months. It's reported in a percentage, and you can see here one of the targets of care is to make your A1C be less than 7%. If you have had diabetes a long time and you're an older person with diabetes, your doctor might say less than 7.5%, but essentially that's just a 3-month average. It doesn't tell you or your provider how much your blood sugar is swinging. The day-to-day tests are what really give us good information about where you might be running high or what medication might better target the concern you've got. Managing blood pressure will also decrease damage to the blood vessels, as well as decrease your risk for stroke, heart attack, and heart failure. For this reason, blood pressure should be checked at each of your healthcare provider visits. Your diabetes care team may recommend a drug called an ACE inhibitor or an ARB in order to help you reach blood pressure goals. These medications also have benefits beyond blood pressure control, including kidney and cardiovascular protection. So the general blood pressure target for people with diabetes, they ultimately recommend it be individualized to the person, but that most people with diabetes and a known risk for heart or cardiovascular disease should shoot for a blood pressure under 130/80. Some other targets of care. We know that even a small amount of weight loss can absolutely help improve blood sugar control and other labs like cholesterol and blood pressure. So people with diabetes who are overweight do show a higher risk for heart disease. A gradual weight loss of about 7%. Imagine 200 pounds, that's about 14 pounds of weight loss gradually. This can help decrease insulin resistance, lower blood glucose or sugar levels, and reduce blood pressure and cholesterol levels. Also, it's recommended that we get at least 5 days of physical activity, or at least 150 minutes per week. Physical activity reduces our cardiovascular risk, it improves blood glucose management, and it increases the potential for weight loss. Physical activity can include things like walking, dancing, swimming, biking, or anything that just gradually lifts your heart. This can even be chair aerobics if somebody's less mobile. We also have a target here that we should try to lower our LDL cholesterol less than 100 milligrams per deciliter if there's no history of heart disease, or less than 70 milligrams per deciliter if there is a history. One of the most effective ways to reduce the risk for heart disease is really to manage your blood cholesterol levels. Lowering saturated fat and increasing fiber and increasing physical activity, and sometimes even taking a medication called a statin, all of these things may help reduce the LDL or bad cholesterol levels. Some other targets of care include aspirin therapy, stress management, and also smoking cessation if somebody smokes. Aspirin therapy has had mixed data. It is not safe for everyone to take aspirin, so be sure to talk to your health care provider or your heart and diabetes care team before starting it. But there have been some suggestions that 81 milligrams of baby aspirin might reduce heart disease in people who already have known heart disease or who are at high risk for heart disease. So this is a report that was given in the Lancet, a journal in 2019, and this is the modifiable dietary risk factors that were identified that were the leading causes of more than half of diet-related deaths in 2017 on a global scale. In 2017, they found that 3 risk factors were associated with the majority of, and like I said, over 50% of deaths in the world, and they were eating too much salt, not eating enough whole grains, and not eating enough fruit. In addition, diets with limited nuts and seeds and inadequate intake of vegetables and limited fish intake were also identified as causing major health concerns. So today I'll be sharing some information about one of the most popular eating approaches that has well-established research showing that it is both diabetes-friendly and has heart benefits, and it's called the Mediterranean eating style. Some basic principles about this approach to eating are that it really does emphasize eating a lot of fruits and vegetables each day. You can see here they recommend up to 8 to 10 servings. Now, a serving is about the size of your palm, but it's a half cup in size, but 8 to 10 servings of vegetables and fruit daily. In the Mediterranean eating style, they also select fish as their primary protein source, but they do also use skinless chicken or turkey and even egg whites over red meats. And in this approach, they often replace saturated fat sources like butter with olive, peanut, and canola oil. So a little bit about each of the basics of the Mediterranean style. The first is that this is a very plant-based diet with you saw lots of fruits and vegetables, that the grains are typically whole grains, foods like oats, brown rice, quinoa, black beans, or other types of lentils and beans and legumes, and that nuts are also a central part of this plan. In the Mediterranean eating style, a person tries to consume 2 to 3 cups of vegetables every day. A cup is about the size of your fist, so imagine trying to eat at least 2 to 3 fist portions of vegetables a day. These can be steamed, they can be boiled, they can be roasted, or they can certainly be raw. It's your choice, but it's preferable that they not be deep fried or coated with a lot of oils or butters. In this approach, they recommend having 1 to 1.5 cups of fruit per day. Now, you may be saying, Christina, with diabetes, fruit produces sugar, and fruit is a natural source of carbohydrate. We know that that's going to give us a little blood sugar when it digests. But fruit have vitamins, minerals, and some fruit are excellent sources of fiber as well. And that can absolutely mean they offer a lot of positive nutrition. A serving for a person with diabetes might be about a half cup in size, and they might have 2 half-cup helpings a day or 3 half-cup helpings a day to get that 1 to 1.5 cups of fruit. They might not put all of that at one time. They might split those half-cup servings and have a little at breakfast, lunch, and maybe even dinner as dessert. In the Mediterranean style, you try to have 1.5 cups of whole grains per day. And as I mentioned, that's things like the brown rice and a lot of those hearty grains like quinoa and oats and oat bran. This is also high in 100% whole grain or whole wheat bread, or this might be a high fiber pasta, for example. But 1.5 cups of cooked whole grains is just about a half cup at each meal, right? And so that's a portion about the size of the palm of my hand per meal. They do recommend getting at least 2 cups of legumes a day, per week. And that's your beans, peas, lentils. That's something that we might try to incorporate a couple times a week as excellent sources of fiber. And in this approach, they do suggest getting about an ounce, and a measure for that is about a 1/4 cup of unsalted nuts or seeds daily. Another principle that we use in the Mediterranean eating style is we really try to reduce the sources of saturated fat. Butter, cream, lard, coconut oil, these are hard, solid fats. And that's a characteristic that helps me identify that they have quite a bit of saturated fat. It's really ultimately healthier for our heart to replace some or all of these with olive oil or other monounsaturated fat sources. So I've listed those here. Olive, canola, and peanut oil are the oils with the most monounsaturated fatty acids per volume. And the suggestion is to try to get about 3 to 6 teaspoons of those per day. Imagine a teaspoon at every meal to 2 teaspoons at every meal. Avocado is an excellent source of monounsaturated fats. That might be chopped up and added to a salad at lunch, or might even be put as a topping on a slice of 100% whole grain bread at breakfast. I could choose to eat almonds, walnuts, cashews, pistachios, or even sunflower seeds, about 1/4 of a cup per day if weight loss is desired, because these are still calorie sources. But those nuts are an excellent source of nutrition and fiber. They also are a natural source of plant-based protein. I can use natural nut butters, but the reason you're seeing natural and on those nuts, the reason that I'm saying unseasoned or unsalted is one of the principles that will help with heart health is if we're really cautious about added sodium or salt. For a vegetable dip, here's an idea. Tahini is a dip made with blended sesame seeds, and hummus is a blended chickpea dip. They're excellent high plant-based protein source dips that are low in fat or almost fat-free, and they're an excellent dip to use with snow peas, carrots, or other raw vegetables as a snack. What a great snack, a healthy snack. In the Mediterranean eating style, we should also favor non-fat or low-fat dairy, including our milk, Greek yogurt, and cheeses, and we might even use unsweetened almond or soy milk. The suggestion is that we try to get at least 2 servings per day, and that be calcium fortified if it is an alternate milk source like almond or soy milk. A serving is 8 ounces of milk or 6 ounces of yogurt. And I would just say to my clients with diabetes, make sure that Greek yogurt is an unsweetened Greek yogurt, or that it's been sweetened with stevia or possibly Splenda. And those yogurts are going to be identified on the front of the label. They'll use the term light. It'll say light Greek yogurt. But this Greek yogurt, I've talked in previous sessions, is an excellent source of not only calcium and vitamin D, but it's a great source of probiotics, which are those good bacteria that can really help us have better digestion and we believe a lot of better health. So if you like Greek yogurt, I can't say enough about having a small portion of maybe a half cup of blueberries and mixing that in with some Greek yogurt, and that being your breakfast in the morning with a little sprinkling of maybe some old-fashioned oats. In the Mediterranean eating style, we also choose primarily those white meats. Again, we favor fish, especially the fatty fish, salmon, trout, over the fish that have very little of those omega-3 fatty acids. I'm not knocking catfish or tilapia. Those are good fish as well, and they're certainly a lean meat. But the salmon and the trout and mackerel and even sardines, albacore tuna, they're rich sources of omega-3 fatty acids, which are known to be very heart protective. We should also, if we choose to have chicken or turkey, try to do those skinless cuts and cook them without the skin. So not leave the skin on as we cook and then remove it later, but remove that skin before cooking. And we should favor those over beef and pork. We should try to limit red meat to no more than maybe once a week or once every other week. You can see here the suggestion on the Mediterranean approach is no more than about 3 times per month, and that we favor those white meats 3 to 4 ounces per day. Now, 3 to 4 ounces is about the size of a deck of playing cards, maybe a little bit bigger. So in the Mediterranean approach, meat isn't the center of the meal. It's something that people have in small amounts and that they might save for one meal a day, like the evening meal or a few egg whites at breakfast. I would also say if you're a big fan of red meat, you can certainly make some heart-healthy changes by selecting the leaner cuts of beef and pork. And those are usually labeled as loin, flank, or round cuts. So sirloin, tenderloin, top loin, or the eye of the round, bottom round, those particular cuts of your beef and pork are going to be less marbled. That means they have less saturated fat. And the fat's going to be more around the exterior where that fat can be trimmed before you grill or bake that meat. They do recommend limiting or reducing your intake of processed and cured meats like sausage and bacon, and even lunch meats, trying to use a little less of those cured meats because they're often very high in salt, added salt or sodium, but they can also be a source of a lot of saturated fat. We should try to bake, grill, broil, or boil, or even oven fry or air fry more often than we deep fry. As to whether we should have dessert, the recommendation on the Mediterranean eating style is to try to limit desserts to small portions of maybe cookie or ice cream no more than once or twice per week. These things are high in a lot of added sugars, and there's just been so much research that finds consuming a lot of hidden added sugars is linked to high blood fats, like high triglycerides. So that's one of the reasons that dessert items they're encouraging us to limit them. Increasing your fruit intake has strong research evidence that shows that can help decrease your sweet cravings. So another big source of added sugars is the drinks we're drinking. Please consider replacing sugar-sweetened beverages with things like water, sugar-free flavored waters or sparkling waters, and other unsweetened beverages like tea or herbal teas, rather than sodas and sweet drinks, sweet tea, sports drinks. 70% of the excess salt consumed today is already present in the packaged foods that we eat when we buy them at the store. So a couple of things that I would like to say about reducing our salt intake. The first is we can absolutely have a lot of flavor if we use herbs and spices to flavor rather than salt. When you're grocery shopping, please look for sodium on the nutrition fact label. If that sodium number is 140 milligrams or less, which is a 5% daily value on your food label per serving, then you have a low sodium food item. Certainly, the larger the number is compared to this 140 milligrams, the higher the salt level. Buying fresh or frozen vegetables or fruits as often as possible is one way to definitely decrease our intake of sodium. But if you favor canned goods, please consider looking for no salt added versions of these canned goods because those will typically have very little added salt. The recommendations for how much salt that we should have per day, you can see for people with diabetes, the total daily recommendation is less than 2,300 milligrams of sodium per day. But if you have known heart disease, research finds that we should limit to less than 1,500 milligrams a day. So buying foods that are fresh rather than canned or packaged is going to be one of the vital things to be able to reach these goals. While those numbers sound very large, I would just point out even half of a can of soup might have 700 to 800 milligrams of sodium. So eating 1 can of soup a day might actually get very close to that 1,500 milligram limit that your heart doctor would recommend. Also, please add fresh garlic, oregano, thyme, basil, cumin, other seasonings like turmeric, cinnamon, and parsley to add flavor as you decrease your salt. You really can help your taste buds look for other flavors rather than salt if you make little changes by adding seasonings and herbs and spices. So those are some of the basic principles of the Mediterranean eating style. You can see we talked about a lot of fruits, vegetables, and whole grains. We talked about limiting salt by adding spices and herbs instead of salt. We talked about maybe eating a slightly smaller portion of meat, choosing white or lean meats over red meats. I want you to know there are lots of opportunities to continue to learn about heart health. And if you want to meet with me and talk further about heart health, we will also be doing some heart health fair, a heart health fair very soon, and I'll share some information shortly. I would just say one more point. Alcohol is absolutely a factor when somebody has diabetes and heart disease. It is recommended that you be cautious. If your medication carries a warning label before drinking alcohol, I would highly recommend you talk to your healthcare provider. Moderation is defined as no more than 1 serving of alcohol for women or 2 servings for men, and serving sizes are small. They're about 5 ounces of wine, 12 ounces of beer, or 1.5 ounces of other alcohol. So please consider, again, if you are drinking, talking to your healthcare provider about the safety and what would be your best course of action related to alcohol. So I was mentioning, we're really excited that Titus Regional Medical Center is going to be able to offer an in-person heart health fair. And the date for that will be Saturday, March 5th. And it's going to be from 8 to 11 a.m. in our mall lobby. This would be an excellent place to meet with not only myself, to talk about nutrition further, but it's also a place where you can meet a number of our wonderful heart and vascular healthcare team. So please know and please try to come to the Heart Health Fair on March 5th from 8 to 11 at Titus Regional Medical Center. Also, if you have questions, I would be happy to answer those questions. And this is my contact information. You can reach out to me by email at christina.graham@titusregional.com. You can absolutely also reach me by phone at 903-577-6099. And I'm also located at the Family Care Center on Harts Bluff Road. I would love to answer any questions or concerns you have. I would also say that if you've got specific concerns that you would like to reach out to maybe the Heart and Vascular Clinic about, their number is 903-577-7070. So that's another point of contact for information about heart and vascular health. We've got an amazing Heart and Vascular Institute here at Titus Regional with a lot of wonderful, knowledgeable healthcare providers to help you with your heart disease. So thank you for joining me today for the February Diabetes Support Group meeting. If you have questions, please don't hesitate to put them in the comment line, and I'll be monitoring those comments for the next 24 hours, and we'll respond to those questions over that time. Or if you feel more comfortable giving me a call or sending me an email, please reach out by both of those. Again, christina.graham@titusregional.com. or my number 903-577-6099. One thing that you might reach out to me to do is if you would like to be part of our diabetes support group email list, please send me a message or give me a call so that I can add you to that email list. I'm anticipating that March's diabetes support group meeting. I'm optimistic and hopeful, and I think it's going to be in person, and that will be at 4 p.m. March 15th at the Titus Cardiac Rehab space that is right behind our emergency room in the same strip center with the KEI Center. So I am really excited that we'll be getting back to some in-person meetings, but please send me an email or give me a call so I can add you to that email list if you're not on it, because I let everybody know before those meetings details about the meetings and where they're going to be. Thank you for joining me today, and I wish you a very healthy February.